You're good.
I'm Dr. Greg Hickman. I'm the medical director and anesthesia director at the Andrews Institute Ambulatory Surgery Center. Our total joint program has been going on for about 6, 8 years, but it's really gotten busier in the last 2, 3 years. And we talk about total joints as an outpatient. 15 years ago, people would have just thought you were crazy talking about doing an outpatient total joint and sending patients home. We worked really hard to develop a protocol and a plan that we stick to. And my side is the anesthetic and the post-op pain management. We developed a lot of certain nerve blocks and continuous catheters and pumps and different ways to treat the pain to allow patients to go home and still remain comfortable. The pain management would have been just impossible 15 years ago, but with the developments in medical technology and medications in the last 10 years has allowed us to develop this, and our patients are doing really, really well. And we've had a reception tonight to have some of these patients in, and their stories are just really, it's really nice to hear them talk about how well they've done, how well they did with their pain, and their recovery. You know, it's still not an easy surgery. You still have to do the therapy and the rehab, and the patient has to do that part. But the stories we're hearing are patients that have had a joint as an inpatient and stayed in the hospital versus going home the day of surgery. They've actually feel better. They've recovered faster, and they've been happier with an outpatient because they get better so much faster because they're stimulated to do more. We have a great team. It starts with our total joint navigator, which our patients meet individually and as in group settings sometimes, and she educates the patients on all the steps for our program. And the education is huge to do outpatient surgery because there's a lot to know and a lot to learn about managing yourself when you go home. Our preoperative team, our pre-op nurses, our block team, our OR nurses, our OR staff are phenomenal. We have great recovery nurses. They're going to help you. We do spinal anesthetics for all our total joints. And so you're going to recover from that in our recovery room, and our nurses know exactly how to walk you through that as you're waking up and that numbness is wearing off from your spinal anesthetic. We feel like we're one of the top places in the country for outpatient total joints. We've got the certification that only 14 facilities have acquired in the United States, and we're the only one in Florida for outpatient total joints. And we're proud of those accomplishments, and we feel like we're kind of trendsetters in outpatient total joints, and we want to keep doing as much as we can to do the best we can.